The stories shared on It Takes Balls are unique to the individual sharing. Always speak with your trusted medical provider for treatment options specific to you. Welcome back to It Takes Balls, presented by Testicular Cancer Awareness Foundation. Today's guest is another guest from the future. I've got Steve Coates joining me from Australia, where it is tomorrow. So Steve, thank you so much for being here.
No worries. Thanks for having me on. I appreciate it.
So, we know you're a testicular cancer survivor being on the podcast, but, tell me what you'd like to share about who you are, as a person.
Yeah. So, obviously, as you said, I'm a testicular cancer survivor. I was diagnosed just last year, 2024. I'm also a doctor. So I work in a couple of different areas. So I'm a GP, like a family physician, and I also work in palliative care. So, and I was doing all of those things before my diagnosis and during treatment. So I guess that's given me a bit of a different perspective on a few things, a couple of ways of looking at it.
Yeah, for sure. So let's talk about what led up to your diagnosis. What was it that you first noticed?
Yeah, so my diagnosis is probably a bit of an unusual one. So I didn't notice any testicular lumps or anything like that. I hadn't been aware of anything. I was actually at work in the hospital that I work at, doing palliative care ward round as you do, seeing people, and I actually had this really sudden onset of abdominal pain. And it's one of those things that you kind of, I guess at the time you try and ignore it, hope it'll go away. Then I realised pretty quickly that it wasn't going to. And then one of the nurses kind of said to me, "Oh, you don't look too well." I was like, "No." I'm not feeling too well either. And then I guess before I knew it, I was being cared for by the nurses and a colleague doctor there. I kind of went from doing my ward round to within like 5-10 minutes I was lying in a hospital bed myself. And I guess that's probably where that is where it all started for me. So at that point it was an unknown. So one of the doctors checked me out, said, "Look, we think you need probably a CT scan, see what's going on, and get some blood tests." And then I actually started to feel better. So again, being human and probably being male, I don't know, I decided I didn't want to go through the test there and then. I wanted to go home. So agreed to do the blood tests on the way home, and I did those. And then, I went home and kind of sat it out for the afternoon, and the pain did kind of settle down. Then the next day, that same doctor who saw me the day before called me like first thing in the morning. And he's really experienced doctor. I've got a lot of respect for him. And he said, "I really think you should be doing a CT scan. Something just doesn't sit quite right with me. That what happened yesterday wasn't normal. I think you should be doing a scan." So the way it works in Australia is you can, as long as you've got your referral from your doctor, you go to they're all private companies. So you go to a private imaging company, and usually you can get in really, really fast. So I went to my local clinic to get a CT scan. And it all kind of, I guess, snowballed from there. So I was actually quite relaxed at that point. I wasn't thinking cancer. I wasn't thinking anything like that. And the pain had pretty much subsided. And after my scan, I was lying on the scanner for a while, and the radiographer taking the images said, "Oh, the radiologist is around and wants to talk to you." So I went off to her office, and I guess that's probably the first point. Things were a little bit different being a doctor compared to not having that knowledge. She was very, very pleasant, but she was kind of straight into it. She said, "Look, there is something there. You've got this huge lymph node." So it turned out I had a big retroperitoneal lymph node next to my left kidney. And she said, "It's almost certainly sinister. I think it's cancer. I can't see where the primary is. I can't see where it's come from." So that was pretty shocking, the way that came about. They took good care of me there. I guess I was on my own at that point. My family didn't know, and then I went straight into my CT chest, and there's no lung mets, which was great. And then she listed off the possible cancers it could be, and one was obviously testicular cancer. And she offered to do an ultrasound that morning, so I waited around, got the ultrasound. So it was all quite rapid. So I had the ultrasound, and almost within 5-10 minutes went back to see her again, and she said, "Yeah, you got a left-sided testicular cancer, and spread to retroperitoneum. So it seems the way I present, it's obviously an unusual way to present, but I think that node had bled and hemorrhaged, and that had caused the pain.
Interesting. Okay. So you said you were lying there for your CT. You didn't, you weren't suspecting cancer. With your doctor background, did you have any suspicions of what you thought it might have been?
No, I didn't. It'll sound strange, but that's actually why I was a little bit reluctant to have the scan, because one thing that had been mentioned was appendicitis by another doctor, and I don't think it wasn't a bad call at all. It was probably the first thing you'd think of, but something, because I'd gone through the symptoms, I guess I was like, no, it's not going to be appendicitis, because it was too quick. I was absolutely fine, and it was this sudden pain, which obviously would have been the bleed. So I was kind of hoping it'd be nothing, and I guess I'd over-exaggerate a little bit, or I was just being a bit paranoid. So, I guess fleetingly, things like cancers would have gone through my mind, as in, if you're having a scan, it could be something like that, but it was not high on my radar. I wasn't thinking it. I thought it was probably a bit of fuss over nothing. And my biggest worry at the time actually was having the scan and then having to have, as lots of guys haven't been through this process now will know, often you have a scan and unfortunately pick up other things. You find a cyst here, or something else that needs a bit of monitoring, a bit of a nodule. So my biggest concern at that time was like, oh, having a scan, I might end up on the whole onward train of more tests for something else. But obviously that wasn't to be.
So what were some of the other cancers that she listed when she first saw that retroperitoneal mass?
So she mentioned like colon cancer, and she mentioned squamous cell carcinoma, which is often starts on the skin, and being in Australia and Queensland especially, there are high levels of skin cancer, and she mentioned lymphoma as well was another alternative, and it's funny, I guess that's one of the big lessons I learned pretty on in this process. I clearly remember at the time thinking testicular cancer would be the best out of them. And I guess that's not wrong, because it is the most curable out of all of them. But I think it really showed me how, I guess, because in the medical world, we look at survival statistics and textbooks, and we think about 5-year survival rates and 10-year survival rates and cure rates. I think we don't think enough about the impact of an illness and a disease and a treatment on people, especially young people, like testicular cancer affects. And I think, that looking back, I think if I'd known what was coming with the treatment journey and the ongoing care, I think it's given me another way to look at that. So yes, obviously it was the best out of those, but it's certainly not a nice diagnosis to get.
Yeah. So you got the diagnosis of testicular cancer, or suspected testicular cancer, based on the ultrasound. What was like the timeline between that and your orchiectomy or orchidectomy?
Yeah. So we say orchidectomy here, but yeah, it was really quick. So that was on a Friday. I had the pain on a Thursday. I had the CT on the Friday morning, and I had my orchidectomy on the Monday. So that was quick. So I guess in that, it would happen quickly in Australia anyway. Like we've got very, very good healthcare here. Probably was a bit faster because I work with an oncologist who suggested a urologist to see, and that urologist actually called me on the Friday morning and said, look, we know what's going on. I know you're a doctor. Rather than having a consult on Monday, we could do the surgery. So I was happy to do that. So I did that. I actually was very lucky. I met my medical oncologist on that Monday as well. So a lot happened very quickly. And then I started my chemotherapy the following week.
Before any of this happened to you, as a GP, had you ever had any of your patients that had been diagnosed with testicular cancer?
So I've got a couple of patients, not that are now my patients, but I wasn't their doctor when they were diagnosed, if that makes sense. So I've got a couple that have been through the journey. And during my kind of training years, my junior doctor years, I did a lot of urology. So I'd been present, and I'd actually done myself some orchidectomies. So I did did a couple of years of urology, so I knew very well what to expect going into that surgery.
Interesting. All right. So, okay. So the orchidectomy, was the recovery for that for you pretty easy, or was there anything notable that happened there?
Yeah, no, that was pretty easy. It was as expected. I think um, I knew it would be a little bit sore. It was kind of what I expected. I think having done the surgery and then had it myself, I kind of it played out, I guess, as I thought it would. So
Yeah. And you went into your orchiectomy knowing already that you had a retroperitoneal mass rather than having a scan after. So, did you already kind of go into the orchiectomy knowing that further treatment was going to be necessary?
yeah, so I guess it all happened a bit backwards in a way. So there was kind of no, although we still needed obviously the tissue biopsy, the tissue sample to say exactly what was going on. There was no doubt with anyone's mind that it was a testicular cancer. And I'd seen the oncologist before the orchidectomy, who'd said you're going to need chemotherapy. And then I saw my urologist obviously before that, who said, obviously, look, we know we need to find out what type of testicular cancer you've got, but yes, you are going to need chemotherapy because the node was too big for a lymph node dissection anyway. It was with curative intent, it would have to be chemotherapy.
Do you remember what your pathology ended up being on the testicle?
Yeah, it was pure seminoma.
Gotcha.
Yeah.
Okay. So orchiectomy, recovery, how long between orchidectomy, and chemo start?
So it was a week. So I had my orchidectomy on the Monday, and I think the next weekend was like Easter, long weekend. So I think I started the chemo on the Tuesday, but it wasn't very long. It was 7 or 8 days.
Yeah. Did you have a Metaport placed or anything?
Yeah, I had a PICC line.
Okay.
I guess you still call it a PICC line in the States. So yeah, I had it in my arm. So yeah, I had that put in the morning of chemo.
Oh, the morning of. Wow.
Yeah.
Interesting. All right. And then you started out with the intent of doing BEP, correct?
Yes. So the plan was 3 cycles of BEP. Yeah.
And then, so tell me about what happened that first week.
So again, this is a learning curve as a doctor. It really shows, I guess, the human side of being a doctor, that you can intellectualize things, but you don't know what something's like till you live through it. So the plan was, the standard regime, three cycles of BEP. So obviously day one, I had my bleomycin, etoposide, and cisplatin. And my whole medical team have been really good at talking to me and my family as very much like as if I wasn't a doctor, which is what I'd asked for. So we kind of knew what to expect. We'd gone through all the normal things of, the nausea and fatigue and hair loss and all those things. So I think we all felt we kind of knew what to expect. And I went into it feeling, not great, but reasonably positive about the whole process. I knew, what the end result should be. And I very clearly remember that first day after chemotherapy, going home, and I felt awful. And I remember finding it hard to describe. It's a very vivid memory for me. I remember just sat down and I was very close to tears and just saying, this is awful. I can't do this for another 9 weeks. This doesn't feel right. But I thought, this could just be chemotherapy, and you've got to get on with it. And just carried on. Then the rest of that week, I had my etoposide and cisplatin. And in hindsight, the rest of the week was not so bad. It was not pleasant, but you get through it. And then week 2, I had the second dose of the etoposide with my chemotherapy. And again, I felt really, really awful, and I couldn't quite describe it. And then this time they went on into the next day. I remember a friend coming over who's a doctor, and I didn't want to get out of bed that day, which is really unusual for me. And she said, "Everyone's worried about you." I can't move. I feel terrible. I just feel so unwell. this must be chemo. I don't know, but I don't know. Um, and then as it turned out, then the next day I was admitted with febrile neutropenia just a few hours later. So then I was in hospital for that's kind of most of the second week, basically, from memory. And eventually my white cell came up and they said, we'll give you your third dose of bleomycin. And then I had that third dose, and then they discharged me home straight away. And then I got home, and the same thing happened again. I felt truly awful. And then within, I think, 15 minutes of being home, I had a high fever. I had, uncontrollable shaking in the rigors. And I remember that clearly because I remember it being a low point because I felt so unwell. And, we called my oncologist. He said, you're reacting to the bleomycin. We need to check things out. Essentially, the way things played out from there was we did more lung function tests, and my kind of basically, essentially my lung function dropped by 50%. So my oncologist said, like, essentially, because I was getting a rash and lots of other symptoms as well associated with it. Essentially, he said, you're having hypersensitivity to the bleomycin. We've got to stop it. It's not safe to give it anymore. So they had potentially weighed up giving it with extra steroids and extra antihistamines and things, but when the lung function test came back that low as well, he said, you're getting the lung reactions as well as the physical reactions. We've got to stop it. So they did, and then the plan obviously then changed from no bleomycin, meaning I'd need the extra cycle of just the EP.
So after your experience with that bleomycin and having that hypersensitivity, did your experience the rest of the 3 cycles, not to say it seems easier, but without having that reaction, was it a better experience? And I say better in quotes.
Yeah, no, it was. Anyone listening to the podcast who's gone through that cycle knows it's not easy. So yeah, it wasn't pleasant, but it was, I guess it was more predictable. I'd have my days when I'd kind of safely predict I'd be a bit more nauseous, where I know I'd be a bit more tired in that second week. So yeah, it was rough, and it got rougher, obviously, the further you get through, as is typical. But I guess those really unpredictable feelings of just that being so unwell, that didn't happen again. And I guess again, it highlighted to me you can't express everything as a doctor until you actually experience some things, and hopefully most doctors won't have to experience this. But I think, despite having all that knowledge and despite feeling that something just isn't right, because I never had it before, I did not know.
Talk to me about, I know you have 2 kids. What was it like for them seeing you, have these fevers, be admitted in the hospital, lose your hair?
Yeah, so I guess luckily in a way they were both really young. So at that point, the youngest was only about 7 months old, so she was really, really young. And the oldest would have been about 2.5, getting towards 3. She was probably, she'd been turning 3 when I was finishing treatment. So I think it was great and lucky in a way that they were so young. Although the older one definitely had a lot more awareness of what was going on. So she knew when I wasn't wanting to play because I was not feeling well, and obviously she noticed and would comment on the changes like the hair loss. And I think in a way we were lucky that she was young enough to, when you kind of just explain that, yeah, my hair's come up because of having some medicine, I've not been very well, she would kind of accept it and to some extent move on. So, and we tried to keep them away from, the hospital type environment. I think they only came in once during the whole thing, and that's when I was in with febrile neutropenia, because I was obviously in for the week. So I think they came to visit once, and the older one definitely did get upset then, seeing drips and treatments, and I think she thought it was coming her way, and she got a bit scared. But yeah, they've adapted pretty well to it, and I think certainly it surprised me, 18 months later, how much the older one especially remembers.
And so 18 months later, how are you talking about it? And are you going to be open about what happened to you, or is it something that you'll wait until she's older to kind of explain?
Yeah, I think certainly I'll be open about it in general. But the more in-depth conversations and explanations, I guess I'll wait till she's older. Um, I think kids pick up on a lot anyway, so they tend to know what's going on around them, even if they can't fully kind of intellectualize it or understand it. So she certainly knows a lot of what's going on, but the more in-depth conversations, I'll wait till she can kind of understand it a bit more. At the moment, she just knows that sometimes I have to go for doctor's appointments, or I went for a scan just last week, and she saw the band-aid on my arm, and oh, what happened there? She asked questions, then I just say, had to have a blood test or whatever, and she's young enough now just to kind of move on from that.
I'm sure she's young enough to not to have a Spotify account, so she won't be listening to this yet.
Yeah, true, very true.
Okay, so we mentioned the 18 months. After chemo ended, you had that big mass before chemo started in your retroperitoneum. What did it shrink enough to not need an RPL&D, or did you end up having the RPL&D?
Yeah, no, I was lucky. So it shrunk a lot. So I was, again, it didn't quite go to protocol in some ways, I guess, because I was scanned again early. When they took the bleomycin out of the regime, they decided to rescan me then to see where we're at for kind of a new baseline. And at that point, it had drastically shrunk. I can't remember the exact sizes, but it had gone from over 35 millimeters to 12, I think. So it was almost there. So all the signs were hopeful that it might shrink enough. And then towards the end of treatment, when I had my post-treatment scans, everyone was happy not to do the RPL&D, which I'm grateful for.
Yeah. So the surveillance schedule for you, does it mirror what it is in the States? Like you go like every 3 months, and then 4 months, and 6, and then a year?
So it's been similar. So I did essentially I did every 3 months for the first 18 months or so, and then it's gone to 6 months. So I've just had a scan now, and then I'm actually waiting to see my oncologist, but I'm pretty confident my next one will be 6 months rather than 3. And
Nice.
they'll keep imaging up to 5 years is the plan for now.
Gotcha. All right. So in those 18 months since treatment ended, or since this began, has this shaped at all the way that you treat your own patients?
Yeah, definitely. It's one of those experiences that it's changed the way I think about lots of, I guess, diseases and lots of treatments. And I think I said at the beginning, I remember very vividly thinking, testicular cancer, that would be the best of a bad bunch. And that's because of my knowledge about it was that it's highly curable, it's highly treatable. The survival statistics are good, which is they are, and that's great. And I think most guys listening to the podcast will already know that, and I hope the ones that don't, do take that on board, that it is a highly curable cancer. But I think it doesn't take into account the journey that people have to go through, and that ongoing journey. And I think to some extent, when treatment finishes and someone's in remission, probably as doctors, we don't realize that ongoing impact is having on their day-to-day lives, the stress of follow-up, the stress of more scans, of more tumor markers. So it's given me a lot more empathy, I think, for people going through those things, but it's a slightly different slant on it. So it's not something that I've, shared with people, but I guess it's shaped the way that maybe I'm treating them sometimes, especially those patients that I'm seeing on the chemo units when they're having their bad days and they're nauseous. I guess I've got that lived experience now where I know what a bad day can feel like. So it's hard not to shift your focus a little bit, but I don't think that's a bad thing. I think it gives me a very different perspective.
For sure. And this is an ignorant question because of the healthcare system being different between countries, but do you have, like, as a GP, do you have regular patients that you see, or do you just see anybody who comes to you, who has a need? I don't exactly know how that works down there.
Yeah, so but mainly regular patients. So it's a bit of a merged system, I guess. So we've got there's a public health system that's open to everyone, and that's kind of state funded, and that's, you know, you've got your public hospitals where you can have treatment for, you know, essentially anything, and then you've got the private sector. So you know, levels of private health cover and private hospitals are very high in Australia. And then in terms of a GP, most GPs are kind of private companies. So people pick their, you can go to any GP. You're not assigned a GP. You go, you choose who you see, and you choose when you see them. So most of my patients that I see are regular, ongoing. So a lot of them knew me before. And in terms of that, I guess a lot of my patients know what I've been through just by the very nature of, I took some time off work during treatment because, you know, my oncologist said you won't be able to work as a doctor because of immunocompromised risks, and, you know, you need to switch off from work during treatment. So I guess it was, I always said to the clinic, it doesn't need to be a secret, you know, to people why I'm off work. And I think when I did go back and, you know, looked a bit more gaunt than I did and had no hair, it was kind of obvious what had happened anyway. So yeah, certainly the healthcare it's a good system in Australia. It's not perfect, like I don't think anywhere else, but we're very lucky here.
And in your thing here, it says QLD. Is that Queensland?
Queensland, yeah.
Okay. The only thing I know about Queensland is my mom used to get the Queensland chicken salad from Outback. So I don't know. But yeah, so a few guys we've had on before were from Melbourne. Yep. I don't know if I said that right. So does, like, I know they've talked about Peter Mac. Does that hospital system go across the areas, or do you have your own, like, high volume center there?
Yeah, so Peter Mac is because I guess different states have different health models. That's kind of a Victoria-based treatment centre, I think, so it's further south. So in Queensland, I live in Brisbane, which is the main city in Queensland. So I think the main high volume is kind of our local public hospital, like the big public hospital. So the urologist that I saw works through that hospital and runs the testicular cancer clinic there. But just by the way I was diagnosed and how it all came about, I was just seen in the private system. But with him, you know, discussing it in the multidisciplinary team meetings in that center. So I kind of got the best of both, I guess.
Interesting. All right. And you may not know the answer to this question, but I'll ask it anyway. Do you know what the incidence of testicular cancer is in Australia? I know there's the 1 in 250 number, but I don't know if that's worldwide or US.
I actually don't know accurately that, but that, from what I've seen, it's the same. So I think kind of the, you know, US, UK, Australia, they're pretty similar, and it seems to be that lifetime risk is about 1 in 250. And then, unfortunately, if you've had one testicular cancer, obviously your risk drops. Well, yeah, risk increases, so the number drops.
What advice do you have for any Australian young man or, you know, adult who's diagnosed with testicular cancer? What would you say to them?
So I guess now, having been through it myself, I'd still hold on to that knowledge that I had before, that it's, you know, for the vast majority of men, it is treatable. You know, what that treatment is going to look like is quite variable, but it's very treatable. But I think I would say don't underestimate the toll it's going to take on you in general, and be very open about that. And I think, again, it's, you know, I'd always say to people, be honest with your treating team, with your doctors, your nurses. Be honest about how you're feeling. They're best placed to monitor things and see the patterns and know whether what you're going through is normal or not. And I think what happened to me really highlighted that. The stuff that I was putting down to, well, this must just be what chemo feels like. It wasn't until my oncologist actually said, you know, very boldly, it would not be safe to carry on. It was it was not a negotiation. So I think just being open with your treating team, and yeah, just being kind to yourself, I guess.
I think you mentioned earlier that you wanted, like, the care team to treat you as a patient and not as a doctor. As for you as the patient, were you able to kind of take that doctor hat off and just be a patient, or were you constantly like analytical, thinking about data the whole time?
So during treatment, I was actually really disciplined with it. I think because from the get-go, I decided that's how I wanted it to be. I wasn't looking stuff up. I wasn't doing any of my own research. I I guess having seen things from the other perspective, where sometimes I've seen people going through lots of cancer journeys for various things, get really caught up in kind of their own research, and actually sometimes I think delving too far into that can be. I'm not saying people shouldn't seek knowledge and shouldn't be knowledgeable about their condition, but I think seeing people go too far down that actually becomes quite a negative. So I think I made that decision quite early on that the base knowledge that I had, I was quite happy with. I had far more than most people, most guys would have going into it, and I didn't want to complicate things. So I was really disciplined at not doing that. Probably after treatment finished, then I started to, with time, look into things a bit more. But I was pretty set on that from the beginning, and I was lucky, I think, that my team were really good at that as well. And my oncologist would talk to me like he would talk to anybody else. And then I think if I did have a question that may have been a bit more, medical, a bit more specific, he would answer that appropriately. And that worked really well.
Nice. Okay. Is there anything else that you want to add before we put a bow on it?
No, I don't think so in particular. I think the message is it is a highly treatable cancer, which is great. But anyone going through it, just be kind to yourselves. Allow your vulnerability to show through, I guess, and don't be embarrassed about that. And you'll have your good days and your bad days, and I guess those bad days as a result make the good days feel even better. There's always a positive. I think I found that a lot after treatment. That there were some rough days during treatment, but the good days of my life now are probably better than they were before. I think those small things in life you appreciate so much more. So it's a journey, but it's certainly not all negative.
Definitely great perspective. Are you accessible on social anywhere people can reach out if they want to connect?
Yeah, probably the easiest to find me on is Instagram. So on there I'm Briz_Steve, so like BRIS_Steve. I'm happy for people to reach out if they want to make contact or got questions. Absolutely.
Awesome. Steve Coates, thank you so much for being on It Takes Balls.
No worries. Thanks for having me on.
For more information and resources for your testicular cancer journey, visit testicularcancerawarenessfoundation.org.